Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today we have a puppy. This 2-month-old German Shepherd puppy, who seems painful when handled, is come in for radiographs. The vet is unable to localize aside from maybe pain on elbow extension. So today we have a lateral view of the right, which I'm showing here, and in a moment I'll switch to the left. Now, I'll highlight some key aspects of my approach to puppy limbs for this case. I'd like to start by saying, and maybe the right word is admitting, that looking at limbs of juveniles can be really confusing. You'll recall from last week that I like to use the ABCDs for my orthopedic cases: alignment, bone, cartilage, devices, soft tissues, and that we hope to work on each step within our It's Your Case series. Today I want to stick with B for bone, because for puppies, the bone is a tricky one because we have these physes to contend with. So when I'm doing my B for bone within my ABCDs, I do exactly as we discussed last week, and I essentially look at all aspects of the bone on all views. And if I were starting here with the radius, I look at the cortex, the medulla, the endosteal and periosteal surfaces, and I trace that all the way. What I want to spend some time on is what happens when you're in the middle of your happy B for bone routine and you come across the physis. What sort of subroutine do I incorporate when I'm looking at a physis? Well, let's get oriented to start with. I'm going to switch to the other limb and orient ourselves with the anatomy, which is another thing that can kind of jump off the radiograph as being a little bit dramatic or different when we start to look at puppies. So here we have multiple physes proximally. This one that I'm showing you here is probably one of the easiest to identify. This is the ossification center of the olecranon or olecranon, depending on how you like to say that. This guy here is a bit trickier, okay? This part, this ossification is representative of the medial epicondyle of the humerus. So this is actually part of the humerus. And you'll recall, and we'll talk about later, when we flex the elbow in our dogs where we're screening for hip dysplasia, so an older dog than this medial epicondyle is what we're trying to get out of the way so we can see more of the ulna. We also have, of course, our distal humeral physis, which I'm showing here, proximal radial physis. Here's our distal radial physis. So remember, that means that the carpus is going to be here. This is going to be our distal radial physis. And then our distal ulnar physis, which is that funky V shape that we all kind of get used to seeing. So when we look at the physis, what I sort of deviate from in my ABCDs is I look at the physis with some additional criteria in my mind. So I said for the long bones, I'm looking at cortex, medulla, periosteal surface, endosteal surface. When I look at the physis, I get right into all those classic radiology words, okay? So what words am I talking about? Size. I'm interested in how wide is the physis. Shape. I would like the physis to have a parallel shape when I look at the epiphyseal side and the metaphyseal side, okay? So in the case of our distal ulna, we've talked about there's an anatomic feature here that the shape is actually a V shape, but you can see that the epiphysis and the metaphysis remain fairly parallel. So that's my size and shape. I also look at the opacity. The physis should be lucent, of course, because it's made of cartilage, and we know that cartilage has a soft tissue opacity. The metaphyseal side is often a little bit more opaque. This is because of the active ossification that's happening here. So I look at the physis in terms of size, shape, opacity, epiphyseal and metaphyseal surface, in which I trace with my eyes, or in this case with my mouse, and I look to see if there's any defects. When I'm looking for a defect, we know that the cartilage should become ossified as it comes into the metaphysis. So that's part of that zone of ossification. If you see lucency in the metaphysis, you should become concerned about the possibility that the ossification process has been disrupted by a pathology. In this case, you can see that the opacity is actually quite uniform and looks quite good. The last thing that I look at, and this kind of plays into opacity or disruption, is margination. So the margination of the physis should be quite sharp, and when you start to see any irregularity, and I don't really see much of that here, or at least not enough that it would cause me to feel concerned, pop to the other one so we can look at it too. The margination you can see is fairly distinct. And of course, there is the odd spot that doesn't look perfect. So like if I were to look at an area of margination, I could point here and say, well, that little piece of the epiphysis looks slightly different. But I have to say, when it comes to physis, that really the key is let's not overread them because things can change quite rapidly there. We know that it's a young puppy, large breed puppy growing quickly. So for me, I think what I would say on this case, when I go through my B for bones and I get into that subroutine of size, shape, opacity, margination of the physis, I'd probably make the following note. I think what we would say is that there's maybe a little bit of flaring here at the metaphysis. So the term that we use when we see a little bit kind of more um, shape where there's a bit of osseous bone that's sticking out on the metaphyseal side, this is quite frequent. And so interpreting flaring can be quite subtle. I'm going to show you the other limb so that you can see that it's quite bilateral. This little whiff of metaphyseal flaring, and I'll just get this arrow out of the way, this little whiff of metaphyseal flaring here, and actually see on the caudal aspect it's even more prominent. This is probably the only thing I would comment about in this case. Now, whether that's a normal anatomic feature for this dog, I think it very likely is. But I wanted to show you this case just to give you an example of how when we're looking through these radiographs of puppies, we really have to wade through a lot of different things, orient ourselves with all these physes. I forgot to show you one of my favorite. Look at how cute the little physis at the accessory carpal bone is. So unclear whether this puppy has pain that's localized or not. From here, it's reasonable to wait on pursuing any orthopedic specific angle for this case because we haven't found any major orthopedic issues on the radiographs. This could be very, very early panosteitis. I'm not sure about early hypertrophic osteodystrophy. So certainly as the puppy ages and if the pain continues and it's localizable orthopedically, repeat radiographs could be a reasonable step. But for today, I think we have nice bilateral evidence of symmetry at the physis, and I would think that this is most likely normal for this puppy. So thanks for listening. Be sure to review the full report associated with this case, and remember, it's your case, so please post your questions on social media.